want to thank everybody for giving us some time. I know you guys are busy with school and everything, but we do have the pleasure of Dr. Nelson Nunez, who is a University of Puerto Rico alum, royalty down there, I'm hearing. I'll let him introduce himself in a second. My name is Will. I'm the Academic and Industry Relations Manager for District 5, which includes UPR. I work for the support organization that supports the owner doctors like Dr. Nunez, in their practice with pretty much everything that's not clinical. So Dr. Nunez and his doctors can focus on the patients. Supplies, we're the second largest buyer from Henry Schein, second to only the U.S. Government. Insurance operations, HR, just any support you need to be a successful clinician and meet your goals. That's what we're here for. So that's who I am. I'll be reaching out to some of you guys after this to see if you guys have any follow-up questions. But yeah, if you need anything, there's a Q&A function at the bottom of the screen. Appreciate any questions. We'll try to get through all of them tonight, and I'll give it away to Dr. Nunez and he can give his introduction and we'll go from there.
All right, everybody. Just for sake of William here, I'm going to go ahead and do the session in English because he doesn't speak Spanish. So I want him to understand what my answers are to all your questions. In a nutshell, I graduated from the University of Puerto Rico in 2010. I know all the faculty there, Dr. Matos, Dr. Zorrilla, Divya Colon, Dunia Rodriguez, en fin, everybody. I know everybody over there that can tell you about me, hopefully good things. I was in the military for 11 years before I went to dental school, and I was in nursing. I was a nurse before I became a dentist. Then I got accepted into the University of Puerto Rico, and that's where I went to. I was class president for all 4 years while I was there, and it was a good experience. After I graduated from dental school over there, I opened my private practice in the city of Arecibo. And I practiced there for about 4 or 5 years, if I'm not mistaken, and then decided to move back to Texas. I have lived more than half of my life here in the United States, and large portion of that time has been here in Texas. So I always was looking forward to coming back. So I decided to sell my practice there and move here to Texas. And I was before being with Aspen, I was working in Houston in a different DSO. And then I had a friend that graduated. Greetings, Glicelet. I had a friend that graduated a year before me and was working for Aspen. And that's how I got in contact with Aspen. I have been with Aspen for almost 4 years now. I own 3 practices, and I'm gonna buy the 4th one now this year. And it's been a great experience. I have been able to grow with the company. My goal is to probably own between 7 to 10 offices, and then hire some good associates and partners to help me develop this market around here. That's all about me. If you guys have any questions or anything in particular that you want to ask me, I'm more than welcome to answer your questions.
Thank you, Dr. Nunez. That's quite the story. Let's dive in a little deeper. So you mentioned that you owned a private practice. A lot of the students ask, and this question's already come up, but what's the biggest difference between your private practice and you've worked for other DSOs, which is valuable, which I'm going to learn a lot tonight too, but what are some of the differences between private practice and not necessarily Aspen, but dental service organizations in general?
Yeah, so one of the main things that, I was a very successful dentist in Puerto Rico. I have a lot of patients. My office was always full, but I was not having any quality of life. So I had to work on the weekends, do payroll, do everything that comes with owning a business, not only the dental portion of it, but the business portion of it. So it was very hard to be a private practice owners and to have a quality of life. The good thing about working for a DSO is the fact that you have a team that is going to take care of the business portion of it. You are the one that makes the decision at the end of the day. They're just there to support you. So that takes the load that I didn't, that I wasn't happy with when I was a private practice owner. I'm able to, do what I love to do, which is dentistry. And I'm able to have a team that takes care of the business portion of it, as far as hiring, if I need to hire doctors, if I need to hire DAs, employees, and anything like that. So I have a team that deals with all that workload that comes with the business portion of it, which give me more time to develop the doctors that work for me, and also to spend time with my family and spend time on doing dentistry, which is why I came into this. I come from a large family of dentists. My grandfather was a dentist. My mom is a dentist. My dad is a dentist. My sister is a dentist. All my uncles are dentists. So dentistry is what I love to do, and the only thing that I know. With the partnership with Aspen Dental, I'm able to focus on doing what I love, which is dentistry, and take care of my patients. At the end of the day, like I said, I have the last saying. They come to me, ask me, present me with the things that I ask for, and then at the end of the day, I have the last word on saying what goes on any of my practices.
Yeah, I think that's a great point. We're here to suggest, and the doctors make the final decisions on hiring. Anything in the practice, the owners make the decision. So I think you hit the nail on the head, Dr. Nunez. This question just came in. Did you start as an associate with Aspen, or did you go straight to ownership?
In my case, I came into Aspen as an experienced dentist. With that said, I didn't want to become an owner right from the get-go, because you have to learn the Aspen model. It's completely different from private practice, on the sense that you have to understand the Aspen system. We don't use Dentrix. We use a specific software that is Aspen property. So we have to learn all that. In my case, I didn't come in as an associate because of the fact that I already had experience. I was an MCD before I decided to become an owner, but they knew that my goal was to become an owner. So the practice that I own here in Texarkana, it was open brand new, and I ran it from the beginning. So once I knew that the business was good, that's when I made the decision to become an owner. Awesome. Usually when you are a brand new grad, we want you to focus on learning the skills and the speed, and that's why we have a mentor program to help you get to that level. Once you achieve yourself and you have the speed and the skills necessary to run the practice, that's when you become an MCD and possibly a partner, if that's what you want to do.
Yes, and for you guys, the MCD is the managing clinical director or lead dentist. It's the person that's responsible. They work under the owner or with the owner. So good question just came in. Did you have the flexibility to choose what kind of dentistry you would provide?
So Aspen Dental does not make any decision on clinical treatment plans or anything. So you as a dentist, you have the freedom. Even my associates that work with me, I don't interfere on their treatment planning. I do help them, because as a brand new grad, there is some limitations that you may have on deciding whether to do one thing or the other. So I try to coach and mentor my doctors to make sure that we are going on the right direction as far as the treatment plan. But Aspen Dental doesn't do any interference with treatment plans or any clinical decision making. That's between the doctor that does his treatment plan and the MCD or the owner. Obviously, if we have to be safe with the patient, if I see as an owner that there is something that doesn't look right, it's my job as a mentor to sit down with that associate or that MCD to discuss the treatment plan and probably provide a different perspective on how to do that treatment plan.
Well said. And this is a good question too. How many associates do you have, and what are they expected to produce when they start working for you?
So I have right now, I own 3 offices, and I have 2 associates, and I hired 2 associates now that are gonna come and join my team. One of them is Dr. Fernandez and Dr. Ramos too. So we're looking forward to bring them aboard. My goal is to have 2 dentists per office, so I'm looking for more associates. As far as the what they're expected to produce, first of all, my goal is to guide those doctors to get them to the level that they need to be in order to be producing money. Obviously, you guys are about to graduate, you know the skills. That's you're gonna be a dentist just like I am, but the experience that I have is gonna help you get to the next level as far as the speed, as far as the money that you're gonna produce. If you're asking numbers, an associate, let's put it on perspective. A regular day for me, I can produce anywhere from $20,000 to $30,000 in one case, but it's because I do implant surgery, I do major surgery, I do IV sedation. So with an associate, it's gonna depend on how motivated that associate is and how good is the transition from school, from seeing 1 or 2 patients to see 15, 20, 30 patients. Okay. So how you develop from one way to another is going to determine how much you're going to produce. Obviously, I'm not going to expect my brand new associates to produce $10,000 in a month or in a day, I'm sorry, when they just graduated. It's my job to mentor those dentists to be able to be happy with what they're doing and to be able to perform in a safe, in a fast manner. Because it's not only about speed, it's about quality. You have to be able to do a quality service to our patients in a very expedite manner. When we're in school, I remember I had 3 patients and they'll give me 2.5 hours for a crown prep or 3 hours for a root canal. I do a crown prep in 9 minutes for a molar. I do a root canal in a molar in probably 20-25 minutes, but I didn't get here from one day to the next. I got here with experience. I've been doing implants since I graduated and root canal since I graduated. So the expectation is going to be a slow process. It's my job as a mentor to get you to where you need to be so we can make sure that you are enjoying what you're doing, that you're safe with what you're doing, and that you're able to see the growth from when you graduated to the point where you're an experienced dentist.
Good points, all good points. And this is kind of a good question too. You have one of your recent hires on the call or on the webinar. What are you, like a doctor and owner like you, what kind of qualities or what do you guys look for in associates or new grads that you interview? What are some of the qualities you're looking for?
One of the most important things is that ambition to grow. I don't want to hire somebody that is just going to come, okay, I just want to go get my paycheck and go home. That's fine if that's what you want to do. But I need to see that hunger to get better, to go from being a student to a graduate to becoming an excellent dentist. I want my dentist that to learn how to do implants. I want my dentist to learn how to do root canals in molars. I want my dentist to learn how to do major surgical procedures. And that comes with mentoring and experience. So to me, one of the most important things that I look for is that ambition to grow and ambition to get better, and also that hunger to experience new things and to be able to go. Let's say that if what you want to focus on is on root canals, to see that desire and that motivation to take charge and be able to do it safely, obviously, but show that desire to grow.
I love that. And that's good advice. And we had 2 questions. We'll kill 2 birds with one stone. What are some of the differences between Aspen Dental and the other DSO you worked with? And why do you think DSOs have a bad rep? And what is your answer to those assumptions?
All right. Well, one of the main difference between Aspen Dental and all the other DSOs is exactly that. You have Aspen Dental and then everything else. Aspen Dental is the biggest DSO in the world. Okay. And that's a good thing because we are able to manage to acquire like supplies and not only supplies but equipment about a very, very low price, which is benefit for us. When you compare that with a DSO, and I don't want to mention any other names, I used to work for one. They make huge promises, and at the end of the day, when I went to work with them, they didn't fulfill any promises. One of the things that I like about Aspen is that the contract is black and white. You're gonna see what you're getting to in paper. You don't, and it's a non-binding contract. If when you have the experience, you don't want to continue, we're not gonna hold you. If you want to leave, you can leave. And we have the same right? If we're not happy with somebody, we're gonna tell them, we're gonna try to help them to get to the next level. But if it doesn't work, we don't want to keep somebody that is not happy, right? So that's one of the major things. So it's a non-binding contract, and everybody, knows from the get-go what to expect. Dr. Fernandez can tell you, we went over the process with her. She came over and visited my office. Now, with great success, and when you're very successful in something, you're gonna have good rep and bad rep. So, and that comes not only to Aspen Dental, that comes in private practice. My dad always says, you are not a piece of candy that everybody's going to love you. And that's going to happen to you as a dentist in a private practice. That's going to happen to you as a dentist in a DSO, wherever you go. You have the key to make your patients happy. Aspen Dental is just a brand. Whoever works in the office is the one that is going to make the reputation, not only for Aspen Dental, but for himself as a dentist. So if you do a great job and your patient love you, you're going to have nothing but good reviews. But even if you are the perfect dentist that everybody loves you, you're going to have patients that simply you don't click with them. And you don't have the ability to get into that person's mind to force them to do a good or a bad review. You just have to see what the situation is. And from there, go and try to deal with the situation, try to help the patient. Sometimes the only way that you can help the patients is to direct them to another dentist, because there is so much you can do. And you guys are going to experience that when you are, wherever you go in your career, in private practice, DSO, whatever, the military, wherever you go, you're going to experience it. I can tell you from a fact, because I have been in 3 different aspects. I've been in the military dealing with patients. I was in private practice dealing with patients, and I'm dealing with patients right now. Not in one office, but 3 offices. I have about 45 employees that work with me. So when you work with so many people, there are so many variants that are going to have an influence on the patient experience. It's how you deal with the patient experience that is going to set you away or apart from other people. I don't think that necessarily DSO, not only Aspen Dental, any DSO have good or bad reputation. I think that it has to do a lot with the patient experience. And just like there are bad reviews, there are good reviews. And I can show you thousands and thousands of good reviews for services that we do. Every year, I do a free day of service in which I provide free dental care for veterans. And we're talking about $50,000, $20,000, $20,000, $50,000, $70,000 free of charge for veterans. And you can talk to any of those patients and see how grateful they are. So I think it has to do with how you as a clinician and how your team has clinicians make that patient experience better for them. And there was a second question to that. What was it?
No, I think you answered it. What do you say to the assumptions that people have about DSOs? I love the free day of service. Love giving back to the community. So I'm glad you mentioned that. You did mention that you have 3 practices, 45 employees. So this question just came in. So when having multiple practices, do you use this system of delegating the administrative aspects of the dental business to every clinic, or do you have multiple systems that work for you?
So in each office, I have an office manager, and I have an assistant office manager, and I also have a regional manager. They are the ones that deal with the daily logistics for the financial portion of the patients, helping them apply for financing, providing the information on the health insurance. So I have a team that deals with that. As a dentist, you focus on dentistry. Now, if there is a situation with one patient that has an issue with the application, with insurance, they come to me and ask me as a provider how I want to fix it. And that not only goes to me as a practice owner, but to the dentist that is in charge of that treatment plan. Obviously, if it's an associate, and there is a situation with that insurance, there is so much that the associates can do other than referring to the office manager to take care of the situation. And I will say that 99% of the time, the office manager can handle whatever situation it is. And if the office manager cannot handle it, that's why we have a regional manager. We have a specific structure and people that I delegate that responsibility for. They just come to me if there is a major situation or a decision that needs to be made of, let's say, a refund or something that I want to do free of charge for a patient or anything like that.
Yep. I've worked in the field, and I love that the way you put that point in that structure, because it sounds like you have a good system in place. So, good question. What are the demographics of your patients, and what procedures do you and your associates see the most?
So, me, like I told you, I do a lot of surgical procedures. So I have patients from I think my youngest patients that I see was 13 years old. With my license for sedation, I cannot do sedation in patients that are younger than 13 years old. But we do have patients that bring the whole family. I have patients that it's the entire family, their kids, their parents, the grandparents, the uncle. So in my office, we don't say no to anybody. Me particular, the only kids that I try to work on is on my kids, because I didn't want to be a pedodontist. I love them. I love kids, but it takes a special skill to deal with kids. And I'm in a position right now on my career that I'm focusing more on major surgical procedures. We do a lot of dentures, but it's not the only things that we do. I will say that just like a private practice, we do everything. I have treatment plans that are anywhere from $1,000 that treatment plans that are $50,000. It all depends on what the patient wants to do. We have a lot of young people in this area that they haven't taken care of their teeth for over 10, 15 years. And there is so much that you can do for them. Obviously, for me, I do a treatment plan like if I'm doing it to a family member, to my mom. I'm not going to do a treatment plan just because the person looks like they don't have money. I'm going to tell them what the ideal is, and I'm going to give them a second option that they can choose from. But I'll say that about 20% are below 13 years old. I do a lot of Invisalign in my practice. We do a lot of Invisalign cases, and those are anywhere from 17 years old to 40 years old. And then the elderly people, in that population, I'll say is about 40%. And then you have the elderly, which is the rest of the percentage that we see also. But even with the patients that we do dentures, we try to do the implant supported dentures all on fours if we need to do it. As far as the associates, they see all type of patients. Obviously, they cannot do implant surgery because when you graduate, you're not trained for that. But we have a system that we want to send all our doctors to be trained on implant dentistry. We're going to send them to a course, and the two students that I just hired, they're going to go through that process in which they're going to do the didactic portion of the implant course, and then they're going to go to clinical course to place implants, because it's in my interest and their interest to grow professionally and go to those different areas that they enjoy to do. So if implant is your thing, I'm going to try to train you so you can start doing implants. If endo is your thing, we're going to try to make sure that you do a lot of endos. If you enjoy working with kids, we're going to help you with that. Also, Invisalign, that's one of the first qualifications that we're going to provide to the dentists when they come in. So it's not just dentistry. We do every type of dentistry that you can imagine, we do here. As far as technology, we use in Dr. Fernandez and Dr. Ramos can tell you that they saw the facility. I have a cone beam in every one of my offices. I have a iTero machine, which we scan all the crown and bridge. We don't do final impressions. We do the scan of the preparation, and we send that electronically to the labs, and they send us the case in a faster way by doing it that way. And we use lasers. We don't pack core, so we use lasers to do the gingivectomy and do troughing around the preparation. That way you can see that margin on the scan that we do. So packing core is something from the past. However, if you want to pack core, we have it for you. But I love technology, and that's why every single one of my offices have the latest technology as far as iTero, laser, cone beam machines. So everything is digital, and anything that makes our life easier as a dentist is welcome in my practices.
Yeah, that's awesome. All that technology. I never heard about the lasers when I was in the practices, so that's something we might have to talk about offline. But so you mentioned, kids aren't your thing. You probably refer them to, a kid dentist in the area. What about if there's, a medically compromised patient or a difficult root canal? What do you guys do for those type of patients in your practices?
Well, in my practices, I do have an oral surgeon that works for me, and also an endodontist. There are cases that even though I've been doing implants for over 10 years, and also third molar surgery and root canals over 10 years, there are cases that I don't want to get into because even the specialists don't want to get into. So obviously those cases, I send it to them. They can deal with it, and they can, manage those patients. But we see medically I have patients with Down syndrome, and as long as they're stable and they are over the age of 13, I'm able to do the sedation. And not only Down syndrome, but we have patients that are paraplegics too, that we can take care of them. We have patients that are from nursing homes that they come over and bring them. We have patients with oral cancer that we treat them. We have patients we don't say no to our patients. As long as there is a need and we're able to provide the services, we do it. Obviously, if you're an associate on an MCD and you cannot handle whatever your treatment plan is, I'm going to be the one that is going to be performing the procedure. Or if you as an associate want to perform a procedure under sedation, I'll be able to do the sedation for you, and then you can do whatever procedure you want to do. But I do have an oral surgeon that works for me, and I have an endodontist that works for me, because for two reasons. First of all, the workload is so much. There's so many patients that physically I cannot do all the surgeries in all three offices. So I have to hire somebody with the same skill set that I have. In this case, will be an oral surgeon, to be able to do those procedures that I'm not capable of doing because of the volume of patients. And the same thing with root canals. As far as the surgeries that we do, like I said, we do implant surgery, and we do implant surgery not only freehand, but we do guided implant surgery with surgical stands and things like that.
I love it. And you hit the nail on the head with the benefits of the specialists that come right into the office and add to the office's revenue. So this is a good question. Did Aspen give you the opportunity to get certified with IV sedation, or like how did you start getting to
That's
IV?
something that I wanted to do because, like I said, I have been placing implants and doing third molars for over 10 years. And it was always on the back of my mind that I wanted to do it. And I did the research, and I found a place where I wanted to do it. So I did it on my own. There is a lot of free CEs that Aspen offered, but a skill like that is something that you as a dentist, you have to wanted to do it and find it and do it. If one of my doctors wants to go on that route, you know, obviously I want to make sure that you're able to perform the procedure that you want to do the sedation for before you can go to an IV sedation course. You have to be able to, you know, be able and safely to do third molars, implant surgery. And then once you have your skills and you feel confident enough that you can do that, then you can take on doing those other skills, because it's very difficult to get certified for IV sedation. And it's not only here in the state of Texas, but any states is getting very particular with general dentists doing IV sedation. They want to make sure that you're doing it safely and that you took a course that is certified by the state. In my case, I took a course out of California, and I submitted all my documents to the state, and it was accepted right away. And I do probably about 4 to 5. The most I've done in one day is 7 sedations. So it's a very very famous or a very wanted skill from the patient perspective, because they don't want to know about what's going on. They go to sleep and then they wake up and it's over.
I love that's offered in your practices.
I see somebody, Crystal, asked a question about the schedule. So we work, we have one late day, which is, it used to be Thursdays, and I changed it for Mondays. We work from 9 to 7 on Mondays. So it's very nice because after a weekend, you just come in late, okay, to work. So you start 9 to 7 on Mondays, then Tuesdays, from Tuesdays to Thursday is 7:30 to 5:30, and then Fridays is 8 to 1. So Mondays 9 to 7, Tuesdays, Wednesdays, and Thursdays is 7:30 to 5:30, and Fridays 8 to 1. And we work one Saturday a month, but in the office that we have more than one dentist, if we open more than one Saturday, not the same dentist is the one that is going to open work on those Saturdays. So as a dentist, you will work one Saturday a month, and you'll know ahead of time what Saturday that is.
Great answer on the schedule. Follow-up question, how many patients do you think you see a day, was the second part of that question.
All right, the office itself, because one thing that is different from Puerto Rico is that here in the States, we have hygienists, and the hygienists have their own patients. You have to, if it's like a periodic exam, the only thing that you are responsible for after they treat the patient is go over there and make sure that everything looks okay and do your periodic exam. So counting the hygienist patients and the patients that the doctor see himself, we're talking about, in my office is very busy. So we see in Texarkana, in a regular day, I'll say anywhere from 20 patients, 25, 30, maybe, depending if you count both patients. As a dentist, half of those patients are hygiene patients. So she's the one, or he, the hygienist is the one that is seeing their own patients, and then we see our patients. If it's a new patient, the process is, and I'm going to run you through the new patient process itself. So when a new patient comes in, we have a team that does the financial portion and the medical history. Then the DAs come over and take care of that patient and take the x-rays. And from there, that patient goes to the hygienist to do the periodontal exam and the perio chart. And once that's completed, then they call the dentist to come over and do their comprehensive exam. Once you finish with the comprehensive exam, that patient goes to the office manager. They deal with all the financial portion of it. I don't speak numbers. I tell them what the treatment is. And then my office manager talks about numbers and everything. And then they start setting all the appointments for that patient. And then you have the patients that are coming to the office just for procedures that are no new patients anymore. And those are the patients that we do surgeries, we do crown and bridge, we do fillings and stuff like that.
Great answer. This is a good question. I haven't had this before. How many ops does your biggest office have?
All the offices have, thank you, Dr. Fernandez. All my offices have seven operatories. One of them is for the hygienist, and then the other offices have, the other 6 operatories are for patient care. And the way I have it set up is that I can do any type of procedures on any type of, on any of the operatories. So if I have to do a IV sedation on operatory number 2, I'm able to do it. If I have to do it on number 6, I'm able to do it. And we have right now in Texarkana, we have 5 DAs. In Mount Pleasant, we have 4. In Bossier, we have 4, if I'm not mistaken. So we have an office manager, we have 2 secretaries, usually we have an assistant office manager, but right now we don't have an assistant office manager in all the offices. And we have our own lab in the office. So all the offices have their own lab, and we have a lab technician that works with dentures on site.
I love it. That's a great benefit to these practices and these buildings that we keep putting up. This is a follow-up. This is personally for me. One of your hires said that you have a great team. How long did it take for you to cultivate a great team, and what are some of the things that you could, I guess, teach younger doctors or the younger clinicians on the value of building a great team?
It all depends on the vision of the dentist. Remember, you as a dentist, you are the leader of that practice. I like treating my Dr. Ramos, I like treating my employees and my doctors like family. You spend all those hours in one building with the same people, even more time that you spend at home. So you have to make sure that they know what your vision is for patient care and your standards, and try to influence those people, not just to follow an order, but to do it because it's the right thing to do. And I think that when you give people the freedom and you give them a voice so they can tell you respectfully how we can twinkle things to make the experience better for the patient, I think that that's how you create a good team for the office. Now, have I always have a good team? No. Dr. Fernandez, this team is good because we have put effort to that. But I can tell you, I have great hygienists and great DAs, and I have had horrible DAs. And sometimes you just have to make the decision. Me, when I see a problem, I don't play with that. I think that a bad influence and a bad person is like a cancer cell that can proliferate very fast. And you could have the perfect team, but if one person is a bad influence, it's gonna mess it up for the whole team. So when I see something that is a problem, first of all, we try to help the person, and we give them every opportunity to get better and to be a team player. But there are some times that you cannot just keep on giving opportunities, and then you have to let the person go and experience a different work environment.
Do you have any openings for a recruiter?
Always.
I love it.
And I need associates, so I'm looking for doctors for my office, in all the offices, because I want to have 2 doctors in every office. I'm buying another office right now, the one in Fernie, Dallas, that is going to open. That's going to be one of my offices. So I'm going to need an associate for that office too, and also associates for the office right now. I need 2 doctors, a lead doctor and an associate also for the Bossier office. So
this is what I always consider the fun part. Let's get into the compensation. We have some compensation questions. What do your starting associates start out in your practices, and what all is included in that package?
So that's a standard number for any new graduates. Obviously, you don't have any experience. You have to create your, grow professionally. So we have a percentage of the total production of the office that we give has a bonus to the doctor, both for the associate or the MCD, whichever the case is. And that percentage is gonna vary whether you're an associate or a MCD, and even a partner, because you always have the opportunity to become a partner in this business with me. So for a new grad, I think the percentage is, and you correct me if I'm wrong, but I think the percentage is 8 to 10% of the total production of the practice. And what that means, and this is very important to explain it, the money that I produce, the money that an associate produce, and the money that especially produce is all part of the office financial, right? So the percentage that you get is not based on your production. So you don't have to worry about whether you produce $1,000 or you produce $15,000. That doesn't matter, because your percentage is on the overall production of the office. My offices, they produce between $250,000 to $300,000 a month. The one here in Texarkana, that varies every month. It depends on, how now with COVID, and we just had a blizzard coming through Texas, so that has changed a lot of things. But consistently, my offices produce anywhere between $250,000, $300,000 a month. The one in Texarkana, the one in Mount Pleasant, and that one is between $150,000 to $200,000 a month. And based on that production, that's the percentage you get. You also get a guaranteed salary. Whether you produce money or not, you have a guaranteed salary that is going to depend on your position. If it's an associate, I think, if I'm not mistaken, is $550 per day, if I'm not mistaken, for a new grad. And that's without counting the bonuses that you get for the production of the office. I am offering also signing bonuses in relocation also for some of the doctors, depending on where they're going to go. It's different for an office that is in a big city. For a small city, you get more incentive for going into work in a small city than in a big city. Obviously, because everybody wants to go to the big city. I don't know why, because I want to stay away from the big city. I'm a big city boy. I grew up in Puerto Rico. Then I moved to New York. I have lived in San Antonio, in Houston. And I love Texarkana because everything is within 5 minutes from my office. And Dr. Fernandez and Dr. Ramos can tell you that. Everything that you need is nearby. And Texarkana is not a small city. When I heard first of Texarkana, I didn't even know where in the map it was. And I thought I was going to come to a very, very small city. But, both Dr. Ramos and Dr. Fernandez can tell you that, especially this town, it's not as small. It's in between 3 different states. I'm within 5 minutes from Arkansas, within 30 minutes from Louisiana, within 30 minutes from Oklahoma also. So very nice area because you experience different cultures and different states. In one day, you can be in 4 different states.
Yeah, and Doctor mentioned everybody's production's in the pot. That also includes the hygiene production.
Yes.
You have your guaranteed daily rate, and like Doctor said, a lot of that depends on location. A bigger city is not going to pay as much because there's more candidates as opposed to a smaller area. Going to offer relocation signing bonus, something that Doctor mentioned. So
I can tell you that from all the doctors that are the owners that are here, there is just I think it's 4 of us here in Texas owners: Dr. Kendura, Dr. Hayes, Dr. Ali, and myself. And from all the owners here in the state of Texas, I think I'm the most generous as far as the salaries and stuff like that. I can guarantee you that. Especially if it's somebody that coming from my island and from my school, because I know those doctors are ready to start working, and I know that any doctor that graduates from the University of Puerto Rico comes with great clinical skills. I have confidence, and I put any student from the University of Puerto Rico against any brand new grad from here, from any school in the States, and I guarantee you they're gonna outperform anybody. So I'm very interested in hiring more doctors from Puerto Rico because I know the skills that they bring into the table.
And I'm ready to meet you guys and set you guys up with Dr. Nunez as soon as I can get down there. Due to COVID, we can't do anything in person, but let's go over that a little bit with this question that just came in. What kind of impact did COVID have on you as a owner, and how did you get through it with the help of Aspen, or what was the plan and how did you get through it?
Let me tell you, if it wasn't for Aspen, I don't know how we would have made it. I can tell you locally, there were a few practices that had to close for good because they were not able to handle the financial burden of how it was impacted with COVID. Having the Aspen in our side help us apply for all the grants and in federal aids that were there for us, for our offices. We didn't have to worry about getting the N95s and all the supplies that we needed because we assigned a team to make sure that all our offices were equipped with all the stuff that we needed. In my particular office, out of my 3 offices, actually none of the offices closed. Well, actually the Bolshire office was the only one that closed, but we had that doctor doing telemetry, which was dentistry over the internet, as far as consults is concerned. In my case, I haven't had a break. The whole pandemic, I have been working. Thank God I haven't got the COVID, but it's because we have all the equipment that we need to take care of the patients. Mainly we saw emergencies because the state, the dental board here in Texas just limit us to do emergency procedures during the pandemic at that time. Right now, they lift all the restrictions and we're able to see every patient. But during the quarantine period, we were able to see only emergency procedures, which included, emergency surgeries for wisdom teeth and any type of surgery that we had to do. Also, if a patient had a denture that broke, that's an emergency because they're not able to eat. So we had to help them with that as well. But we were able to help the community because we didn't have to close. All the offices around us were closed and we were the only offices that was open, which in a way helped us because all those patients are still with us now.
That's good to hear. Great to hear. I have a question. Personally, for me, you mentioned that you were hiring for Bossier. Does Aspen do any hiring events that you may have attended that some of the students might be interested in? If we have another coming up March 13th.
Yeah, we have the what is it called? The
virtual vibe.
The virtual vibe. Usually we do it in person. And we bring the students. It's a great event when we did it in person because we were able to meet face to face, and we had a lot of activities. We had a very nice dinner. We show you the facilities and everything. Now we're doing virtually because of COVID, but it's kind of the same experience. We're able to talk to the candidate face to face through the Zoom or the iPad, and I'm able to answer more specific questions. Not only that, but I always encourage whoever is interested in coming and visit. I often talk to the recruiters to get them, a flight, and we'll book you a flight, we'll book you a hotel, and we'll rent a car for you to come and see the facilities. And it doesn't mean that you have to sign with us. It's just a way for us to bring you in so you can see the facilities, see all the stuff that we tell you in this type of activities. Because I think when you come over and see it for yourself, that's when you realize if you're going to like it or not, or if what we're telling you is true or not. I want to see things personally. And when I came to Aspen, they pay me for a flight. They booked me a hotel. They booked me a car. And I was able to see that. I did the same thing with the doctors that I hired. And they came over, and, they were able to see the facilities. So if anybody's interested, the invitation is there and you can help it. And also, what's his name? The other recruiter here in Texas.
Shane.
Exactly, Shane and I forgot the other guy name, but I talk to them constantly, and they're able to book them the hotel and the card and everything. And you don't have to spend the money from your pocket. We'll fly you over, and then you can make the decision if you want to join us. Fine. If you don't, at least you took a trip out of Puerto Rico and came over, and got some free meals and free stay.
Yeah, so if you guys are interested in career guidance, this will be our third vibe that we've had. It's just so packed, and we're not able to get everybody in front of owner doctors that we're doing it again on March 13th. So if you're interested, you may be busy, but you can still register. There's a pre-session, and then hopefully if you want to interview with some of the doctors like Dr. Nunez, we'll get you in front of them, get you some FaceTime, and hopefully find some fits and some positions for you guys. So I'll include all that information in the follow-up emails that I'm going to send out after the event. So,
make sure you send me the link, because I need to register for that buyout. I know I have it in my email. If you can forward that to me, because I need to interview some candidates too.
Yep, I'll make sure that we get that out to you, Dr. Nunez. This question just came in. You mentioned that you provide, or Aspen provides implant training, and you have the implant mentorship. You provide, or Aspen provides the ortho training. What other CEs, or what kind of CEs are available, or is there a CE program that's available for employees once they're aboard, or something that they can use to, I guess, perfect their craft?
There is CEs free of charge we have a website that is for all the doctors, and you can go in there. We have a learning department that provides free CEs for all the doctors. And not only that, if there is a CE, for instance, one of my doctors, the doctor that I have in Mount Pleasant, she wanted to get more CEs and hands-on on endo, and she found a course. She asked me if she could attend and I could cover for her. So I say, hey, yeah, go ahead. And I took care of her patients while she went to go and take that course. So it depends on what is it that you like and which specific course you want to take. If we don't provide it in Aspen, you can do the research, and we're gonna provide the time for you to go get it. Like I said, I want to work with people that are willing to grow professionally. I know the doctors that I hired, they are interested in doing implant dentistry, and also doing endo and stuff like that. So we want to make sure that you are happy with the path that you want to go through, and we want to help you get there. With me, you're going to have a mentor that is going to help you do implants if that's what you want to do, help you do endo if that's what you want to do, teach you how to do alveoloplasty and toric removals, help you how to do guided implant surgery if that's what you want to do. Not all the owners have the skills that I have. I will say that out of the owners that we have in Texas, we're 4, and only 2 of us do IV sedations at this time. And the other one, I think she's in a course right now getting her certification on IV sedation. When I did the IV sedation, I paid it out of my pocket because that's something that I wanted to do. It's not a cheap course. It's very expensive. So you have to, know what you want to do. And if that's what you want to do, hey, we're going to help you with that.
And not only the Dr. Nunez or any mentor or owner doctor, but that's our job too, as the support organization. Help you reach your goals, whether it's clinically, business, professionally, whatever it is. We're your partner to reach those goals. So great answer, Doc. Before we do the raffle, we're getting close to the end, so we have a few more questions that will come through. I like my doctors on my events to share one memorable case or patient where you changed a life, because I love to hear them, and it's great. And all doctors have one case in the back of their head. So will you share that with us, and then we'll get to the raffle of the Apple AirPods.
What was that again? Because I was looking at the chat and see if I missed any questions. Say that again.
Oh yeah, sorry. And I posted right now, due to COVID, Doctor mentioned that CE library that's available to employees. It's actually available to everybody, and it's aspendentalce.com/welcome. You don't have to be an employee. It's open to everybody right now because we're in a pandemic and people are working from home. So if you want to go check
There
out the
you go.
library, you're more than welcome to. But my question, Doc, was one case or one patient where it sticks in your back of your head since you've joined Aspen, where you've completely changed the life of the patient and kind of what hoops you went through and how you helped them.
Yeah, so I had this guy that came to my office. He had a previous history of drug use, and he's a very young guy. I think he's on his 20, he's 25, 26. He came over to the office. He had stopped using drugs. He's very religious right now. He started a new job and everything. His treatment plan was over $30,000. It's a case that we had to do full mouth extractions, alveoloplasty, possible implants and everything, because all the teeth that he had remaining were in pretty bad shape. This guy had just started his job. Obviously, he couldn't afford it. He didn't have any insurance. But his case always stayed on the back of my mind. Somehow we became friends on Facebook. And throughout the year, I saw all the struggles that he was going to and how hard he was working to get better, how he went from being a drug user to becoming the person that he's now. So one day I just decided to tell him, hey, I need you to come to the office because I want to talk to you about something. And, he saw the message and he didn't answer right away. He said, yeah, I need to come over because I have another tooth that is bothering me. I want to take care of that tooth at least and all that. So long story short, he decided to come to the office. I told him, hey, it's very important that you need to come over here. I saw something on your x-rays that I need to talk to you about because I wanted to have him come over. So when he came in, I talked to him. I asked him how he's fine. He has a little daughter. She's, I think, 7 years old. So we talked about what he was doing. I told him that I was following on Facebook and seeing all the good things that he's been doing. And I told him that, I know your treatment is about $30,000, but I made the decision that I'm going to do all the treatment for you for free. He couldn't believe it. He thought that I was playing with him. He started crying. He started praying. And he has changed from somebody that didn't used to smile to now he's posting on Facebook selfies all that. He had become a model, I would say, because he's working out. His life has changed from one way to the other. And this is something important because it's not about money. You as a dentist, you're gonna make money wherever you go. Okay. And you have to give back. I'm a very religious person, and I think that the success that you're gonna get is gonna be dependent on how you give back to the community. And giving back doesn't mean that you have to do $30,000 worth of free work. You can do an extraction for free. You can give to the community. You can just help somebody that needs it, and you're gonna get those rewards. That's just one of the cases that I have. But just like that, I ride motorcycles, and the technician that works on my motorcycle every day. I saw his teeth and it's a mess. I talked to him and he's a hard worker. I asked him the other day, hey, have you ever thought about taking care of your teeth? And he said, listen, I have been thinking about that for years, but I don't have the money. I don't have insurance, and I know it's going to be a lot of money. And I told him, why don't you come and see me? Let's see what we can do. He came over and then I did his case for free. In that case, we're actually doing the surgery for him next week. And that's another case. He couldn't believe it. He said, how is it possible? What do you mean that you're going to do it for free? Do I need to do a payment plan? I said, no, I'm just going to do it for free because you have to help people. You have to give back. You are not going to be successful if the community doesn't see that you are giving back in some way. One case that you do for free translate into maybe 20 cases that you're going to see the rewards, because those people are going to talk to other people and they're going to bring it back. So I'm not shy of helping people when I need to. As an owner, I have the ability to do it. Aspen doesn't tell me what to do or what not to do. I'm the one that makes my decision. So
I love it, Doc. That's the impact that you guys make. It's crazy. I love it.
And if you guys want to see the pictures from the before and after of that case, friend me on Facebook and I can probably show you the before and after. I'm not sure if I show it to some of the doctors that had come over, but if not, I can provide those pictures, the before and after, and you're going to see the change on this guy. I'm telling you, he became a different person to the point that my secretary wanted to start talking to him and say, hey, we can have that here. So yeah, good guy though. He's a good guy.
Well, we've reached the end of the event. That hour flew by. Thank you for all the questions, Dr. Nunez. It was a pleasure getting to know you and meet you. And I look forward to doing this in person in Puerto Rico, hopefully this summer. I know you got some family you would like to go see down there. We can kill two birds with one stone.
Yep.
But like I said, we're giving out a set of Apple AirPods. Dr. Nunez, if you'd pick me a number between 1 and 24, and I'll announce the winner and I'll reach out to you to get your address.
All right. Let's see. 1 to 24. Man, why do you put me in this position? I wish we can give one to everybody. Let's say 17.
17. Let me see who that is. Okay. The lucky winner is Natalia Castro. So Natalia Castro, I will be sending you a set of Apple AirPods, and I will reach out to you to get your information. Again, thank you guys for joining.
Felicidades, Natalia, que los disfrutes. Okay.
What'd you say, Doc? Just so I can.
I said congratulations. I hope you enjoy it.
Okay. Well, Doc, I'll be in touch. If you guys, I'll reach out to you guys later this week with the follow-up email. And Doc, is it okay if I include your email address?
Yes. Include my email and my phone number. Okay. And also, if you guys look for me on Facebook, I'm under Nelson R. Nunez. My dad has the same name. All my brothers, we're Nelson Nunez. We have middle names. So when you try to find me, you can look for Nelson R. Nunez and send me a friend request and I'll accept it. I look forward to having you guys come over. Like I said, I'm hiring doctors and I want people from la Isla del Encanto para traerlos para acá y adueñarnos de Texas aquí. I told him I'm looking for people from Puerto Rico so we can take over Texas here.
I'm okay with that.
I already see all the friend requests that I'm getting. I'm assuming from the doctors there. So I'm about to accept it in just a second.
Okay. Everybody
me hace falta el mofongo, los piononos, el reggaetón. Me hace falta. Tengo que no voy a Puerto Rico hace más de 4 años, yo creo. Estoy loco por ir para allá para comerme un mofongo, Ave María, y un pionono.
Okay. Have a good night, everybody.
Say hi to Dr. Matos, to Dunia, to Divya Colon, to Dr. Orsini en cirugía, Dr. Echavarría, everybody, a todo el mundo me lo saludan por allá.
Get some rest, Doc.
All right, take care, guys.
Have a good one.
Bye-bye.